Ready. Good afternoon, everyone. Welcome to the Medicaid Eligibility Listen and Learn. My name is Sarah, and Kara and Donna will be presenting today. Please remember this is a public forum to keep your questions general. There will be a question and answer session that will happen after the presentation. Also, please remember that the presenters cannot answer questions specific to your legal situation, but instead only give legal information. Now let's get started. Thank you.
Hi, good afternoon. So my name is Kara Neaton. I use she, her pronouns. I'm a staff attorney at Legal Aid of North Carolina, and I'll be presenting today with Donna from the North Carolina Navigator Project. We are going to be talking about Medicaid eligibility and the ACA marketplace. So just to give you an idea of the types of things we'll cover, first we're going to talk briefly about why this is important in North Carolina and particularly right now. Then we'll talk a little bit about Medicaid eligibility, something called the coverage gap, and a little bit about like knowing your rights with respect to Medicaid. Then Donna is going to talk us through the marketplace. So again, looking at eligibility, the preventive care and essential health benefits that are covered through insurance from the marketplace, cost saving programs, and how the navigators can help. And then finally, we'll wrap it up with a recap, some resources, and we'll have some time for questions. Like Sarah said, just a reminder that this is a public forum, so please do not share any personal or confidential information. And because we don't have an attorney-client relationship, I cannot give you specific legal advice, but I'm happy to talk about general eligibility or programmatic questions. So why is this important in North Carolina? I think most people know healthcare is really important. Medicaid provides free or low cost healthcare for some people who may not otherwise have access to it. And marketplace plans and the subsidies that Donna is going to talk about also provide access for people who might not qualify for Medicaid, but still need health insurance. It's always good to know your rights and to understand your options. And this is especially important in North Carolina right now. There are a couple important changes coming up that may affect Medicaid coverage and or eligibility. First, President Biden has announced that he will not be extending the COVID-19 public health emergency, and that impacts many things, one of which is Medicaid coverage. So during the pandemic, since March of 2020, state Medicaid programs were required to provide continuous coverage. That meant that they could not remove people from Medicaid, even if those people might have become ineligible for the coverage while the pandemic was ongoing. Now that the public health emergency is officially ending, North Carolina Medicaid can resume eligibility recertifications beginning in April. They normally do those every 6 to 12 months. So it's expected that many people will lose their Medicaid coverage in the coming year throughout the country and also here in North Carolina. So we want to make sure that folks here know the eligibility requirements so they can decide what to do if their coverage is terminated. And these will be things that we talk about throughout the presentation. So things like whether you could appeal a decision or reapply for Medicaid, or talk to a navigator about how to get insurance through the marketplace. The second change in North Carolina is to do with Medicaid expansion. You might have heard in the news recently that North Carolina legislators reached an agreement to approve Medicaid expansion in the budget. Just like the name implies, that would expand who is eligible for Medicaid in North Carolina. It has not happened yet in terms of like the budget will not be passed until most likely this summer. So it's not a finalized piece of legislation at this time, but it's definitely something to pay attention to as North Carolina Medicaid resumes the recertification process. So with that said, let's dive into a little bit of the North Carolina Medicaid specifics. North Carolina has many pathways, as they call it, to Medicaid eligibility. There's something like 20 or so different ways that you could qualify for some type of Medicaid coverage in the state. So these groupings that are listed on the screen are somewhat generalized and some of the more common categories. And so that includes children, so anyone under 19, pregnant people, parents or caretaker relatives of children under the age of 18, people with disabilities, and people who are 65 years or over. A couple other important notes. You know, like I mentioned, there are other pathways to qualify for Medicaid. So we can't cover all of the other types, but there are programs that help low-income Medicare recipients pay for their Medicare premiums. There are coverage programs for children in foster care and some adopted children, for people with breast and cervical cancer. So if you might have a particularly special situation, I encourage you to look into it and talk to your local DSS office to see if your particular situation applies. Another note is that if you're automatically eligible, or if you receive SSI, sorry, you're automatically eligible for Medicaid coverage. Finally, I just wanted to note that if Medicaid expansion passes in North Carolina, it will expand the eligibility, just like the name suggests. So adults age 19 to 64 with low income could qualify for Medicaid regardless of their disability or family status. So in other words, a person without a disability and who is not necessarily pregnant or a caretaker for a child under 18 could still qualify based on their income alone. I also had a note in here that immigration status can affect your eligibility for Medicaid. Typically, in many cases, there's a 5-year waiting period before a lawfully present person could enroll in Medicaid. That said, there are cost sharing reductions or tax credits that you might be eligible for through the marketplace. And Donna will, I think, tell us a little bit more about that later. So if you fall into one of those groups of people that we talked about, you must also then meet the income and resource requirements for Medicaid. If you're in one of the kind of adult categories, so when I say that, I'm referring to essentially the over 65 blind or disabled adults. It generally follows the SSI requirements, which means that there's a $2,000 resource limit for one person and a $3,000 limit for 2 people. Child and family status related categories generally do not have resource limits. And when I say child and family status categories, I'm referring to the groupings for children, for pregnant people, etc. In addition to those resource limits, you also have to qualify based on your monthly income. The monthly income limits are generally framed as a percentage of the federal poverty level, which is something that's set every year. The adult categories generally are 100% of the federal poverty level, and the other family status related categories and children's categories are higher. So just as an illustration, I put a couple different comparison points in this table. So you can see that for a household of 2, the income limit is about $1,600 a month if you're applying under one of the adult categories, such as you're 65 or older, or you have a disability. If you were pregnant, the limit would go up to $3,200 per month for a household of 2. And if you were a child qualifying in a household of 2, it would be $3,468. So that can be a pretty big swing among the different categories. I also wanted to take a minute to talk about what household means for Medicaid purposes in North Carolina. This can be a lot of different things, and different families have different sizes and structures. So the adult categories, when we say a household, it's generally looking at your income and resources and those of your spouse, if you are married and living together. For children and the family status related categories, those typically look at what's called the MAGI method. That stands for Modified Adjusted Gross Income. And it typically follows tax or IRS rules. So the household would include the tax filer, the spouse, if that person is married, and any person that you claim on your tax filing as a dependent. Importantly, MAGI, like it says, is modified, so it's not quite the same as the adjusted gross income on your federal tax return, but it in many cases can be similar or the same. A couple of things to note are that Social Security benefits that might be non-taxable do count in your MAGI, but you do not count SSI benefits when calculating your income. So just to repeat that, something like disability benefits or retirement benefits would count as part of your income, but SSI benefits would not count when you're calculating your modified adjusted gross income. Like I said, North Carolina is approaching a place where they will pass Medicaid expansion in the budget. The state legislators reached an agreement that they announced last week, and we will find out in the coming months if that comes to fruition in this year's budget. The flip side of Medicaid expansion is what we call the coverage gap. So you might have heard this term before, but it refers to the people who have low income, but do not qualify for Medicaid coverage, yet at the same time, they are not necessarily able to afford a marketplace plan, or they might not make enough money to qualify for a marketplace subsidy. So as you can see in the center of this graphic, there's a group of people that are in that gap in between Medicaid coverage and the marketplace. And if Medicaid expansion does pass in North Carolina, the state will be joining, I think, about 38 other states at the moment in the country who have expanded Medicaid. And typically what that does is it creates an income requirement for adults. And there's no other requirements such as having a disability or being a caretaker, like I said before. So next I wanted to talk about a couple things that you can do in light of all of this information. If you currently receive Medicaid coverage, make sure that DSS, Department of Social Services, has your current contact information. This is important because they're going to be mailing out those notices for recertification, and they'll be requesting information from people to verify your ongoing eligibility. If you have moved or have any new contact information, make sure that they have it so that the notice gets to you when they do send it out. And if you receive the recertification or renewal form from DSS, fill it out and return it to DSS as soon as you can. If you happen to receive a denial or a termination notice from Medicaid, you have several options. You can appeal the decision. You can also apply for coverage through the marketplace. You can also reapply for Medicaid at any time. A couple of notes about appealing the decision. If you appeal within 10 business days, your benefits will continue while the appeal is pending. And you have 60 days typically to appeal a decision. However, with the public health emergency ending, with the public health emergency, that has been extended to a 90-day period to appeal the decision. And now I will pass it over to Donna to tell us a little bit more about the marketplace.
Hi, everyone. My name is Donna Rasmussen, and I'm the training co-director for the Navigator Consortium, which is a project of legal aid. But we work with a lot of other organizations across the state to promote healthcare access. So if you'd like to go to the next slide. So if you're no longer eligible for Medicaid, and say it's a correct decision, you haven't had to appeal, maybe your income situation changed and you're just no longer eligible. So if that happens, a navigator can help you figure out if you have any job-based coverage options, and then transition to marketplace coverage if you don't have an affordable job-based option. And then if for whatever reason, maybe it's income or immigration status, if you can't enroll in a marketplace plan, we can connect you to local free and low-cost sliding scale clinics that will provide care regardless of your ability to pay. Next slide. So Kara already mentioned that you should be looking out for notices from Medicaid about renewals and redeterminations, and make sure that you're submitting that promptly. So you've done all that, and you find out that you're no longer eligible. You might receive a notice from the marketplace itself, encouraging you to apply, and they might also include contact information for local navigators that will provide free assistance. And you might also receive direct phone calls from local navigators encouraging you to apply and offering you assistance. Next slide. So navigators, we are federally certified. We provide free unbiased help for people who are trying to figure out what their health coverage options are. And whether that's enrolling through the marketplace or Medicaid or a job-based program, we can help people kind of sort out what it all means. So we meet with folks one-on-one. We help you complete the application, estimate your household size and income, which can be challenging. And then you can apply for financial assistance. Most people are eligible for financial assistance to enroll in marketplace plans. I think 9 out of 10 people. who enroll are eligible for financial assistance. And then once, we have submitted your application and we see what kind of financial assistance you apply for, then we'll help you go through all the different plan options and figure out what works best for you. Are there certain doctors that you need to keep seeing? Are there certain medications you need to keep taking? Do you prefer, one type of health plan over the other? Are you more concerned with budget or with making sure that you get all the services that you need? So there's a lot of different factors that go into making that decision, and there's no one size fits all plan. So, we're going to make sure that you fully understand all of your options, but we're not going to choose a plan for you. Next slide. So it's easy to schedule an appointment with a navigator. We'd offer free in-person appointments, and they can be, actually in person. They can be over Zoom. They can be over the telephone. We're flexible in terms of working with folks' schedules. We know it's all over the place. You can also go to ncnavigator.net. That's our website, and you can schedule a free appointment online with our scheduling tool. You would just put in your zip code and then see what appointments are available in your area. And you can just book it directly online with that navigator. If you're less comfortable with going online, you can call our helpline at 855-733-3711, and they will get you connected with an appointment. Next slide. So the health insurance marketplace may be something new to you. So basically it's private health insurance. So it's not offered by the government. The government basically just hosts a platform where private health insurance companies can offer different plans that all have to, meet certain quality standards and cover certain services. So a lot of people qualify for financial assistance. I mentioned 9 out of 10 people who enroll qualify for some kind of financial assistance. So it can be really affordable, more so than you think so. And there are tools that you can use to kind of see what sort of assistance you might qualify for. So generally, you can only enroll in the health insurance marketplace during the annual open enrollment period from November 1st to January 15th. However, if you lose coverage, such as you lose your Medicaid coverage or you lose job-based coverage or you're coming off of COBRA, something like that, you would qualify for a special enrollment period to then enroll in marketplace coverage, even though it's outside of the normal enrollment time. Next slide. So the Affordable Care Act is what created the health insurance marketplace, Obamacare. People call it different things. But what it did was eliminate out-of-pocket spending limits. So for example, in the past, an insurance company might say, we're only going to pay a certain amount of money if you get cancer. And once we've spent that amount of money, anything else is up to you. So the Affordable Care Act got rid of that. Now there are out-of-pocket spending limits so that once you've spent a certain amount towards the cost of your medical care in a given year, the insurance has to then kick in and pay 100% of whatever's left, which is great. It protects you from really high unexpected medical costs. And there's certain preventive services that are covered at no cost to consumers without having to pay a copay or co-insurance or meet a deductible. And that's things like, screenings and vaccines, contraception, women's wellness visits, physical exams, mammograms, prostate exams, all that kind of stuff. Before the Affordable Care Act, insurers could deny coverage to people if they had any kind of pre-existing condition. So for example, I have arthritis. Before the ACA, an insurance company could have said, no, we're not going to cover you because you have arthritis, or we're not going to cover anything related to your arthritis. And that went away with the ACA. So in addition to not being able to deny coverage for pre-existing conditions, they can no longer charge different premiums based on gender or those pre-existing conditions. It used to just be more expensive to be insured as a woman before the Affordable Care Act because the insurance companies thought that women would use more health care, and so they just charged more, and that went away. The only way that they're allowed to charge different premiums are based on age, tobacco use, geographic area, and family size. Next slide. So these are the 10 essential health benefits that all marketplace plans have to cover. So, ambulance rides, hospitalizations, emergency services, anything related to pregnancy, maternity, newborn care, mental health and substance use disorder services, which is huge because that did not used to be included by most insurance plans. And we've got, prescription drug coverage, pediatric services for kids. I already mentioned the preventive and wellness services. Then it also covers, rehab and habilitative services and devices and lab work. So it's comprehensive in terms of what marketplace plans cover, and any plan that's offered on the marketplace has to include these 10 essential health benefits. Next slide. So who is eligible? So you've got to live in the US, be a US citizen or lawfully present, and not be incarcerated. So I'm not going to go through the whole list, but there's some marketplace eligible lawfully present immigration statuses. And then unfortunately, DACA recipients are not eligible to enroll in marketplace plans. And people who do not have an eligible immigration status are not allowed to enroll in marketplace plans. But that's where, we can connect folks to, local free charity sliding scale kind of places that will serve people regardless of immigration status. Next slide. So how does health insurance actually work? So, obviously no one wants to get sick or hurt, but, life happens, and it helps protect you from, really high out-of-pocket expenses. So say you didn't have health insurance and you got in a big car accident, you might be looking at a $50,000 hospital bill if you didn't have insurance. But if you had an insurance plan, then there would be an out-of-pocket spending limit. And the highest out-of-pocket spending limit this year is $9,100. So even if you have a $100,000 hospital bill, you'd only be responsible for at most that first $9,100, and then the insurance would have to pay for the rest. So, the health insurance it's basically a contract between you and the insurance company. You pay a monthly premium and they agree to pay part or all of your medical costs when you get sick or hurt. And then each plan has a summary of benefits and coverage that's going to lay out exactly what everything costs and what services are offered under the plan. Next slide. So you're going to pay a premium every month. Even if you don't use it, it's like a gym membership, you still have to pay. And you also may have to pay a deductible each year. And a deductible is basically the amount that you have to spend full price out of pocket towards your health care before your plan will start to pay its share of services. Now, depending on your income, your household size, what kind of plan you choose, there's a lot of different variables that will, determine how much your premium is and what your deductible is. And then, different kinds of health plans offer different benefits, and some are going to limit, which doctors or hospitals or providers you can use. But generally, when you go to see a provider or pick up a prescription or get a service, you're paying either a copay or coinsurance. Next slide. So cost sharing is sort of the general term for deductibles, copayments, and coinsurance. Not all plans have all three types of that cost sharing, but you're likely to encounter, at least one of those. So once you've paid your part of the cost sharing, the insurance company covers the remaining cost. So next slide. So here's an example of a copay versus coinsurance. So a copay is a flat fee that you pay for a medical service. And it's usually, it applies before a deductible is met. So if you see a service with a copay, it usually means that you can get that service with a copay without having to meet the deductible on the plan. And in this example, say $100 doctor visit, a copay, $20 copay, you're going to pay 20 and the insurance is going to pay 80. If you had co-insurance, that's a percentage that you pay after your deductible is met. So if you had a $100 doctor visit and you were paying 30% co-insurance, it would be a $30 charge, and then the insurance would pay the other 70%. So copays are common for things like doctor visits and prescription drugs. You might encounter co-insurance when you're getting things like diagnostic imaging or lab work, things like that. And then different types of health plans, some might have more copays, some might have more co-insurance. It just depends on the type of plan it is. Next slide. So this is kind of a visual illustration of the deductible and the out-of-pocket maximum. So the plan's deductible, that's the amount that you're going to have to spend out of pocket before the plan starts to pay for their share. So of course, different plans are going to have different deductibles. Once your deductible is met, you're going to be paying copays or co-insurance, and then your insurance is going to pay whatever is left over. Once you hit your plan's out-of-pocket maximum for the year, which on plans for 2023, like I mentioned, is $9,100, your insurance has to kick in and pay 100% of any of your healthcare costs for the rest of the year, as long as they're covered services under the plan and they're in network. So, $9,100 is still a huge amount of money, but it's not as much as $50,000 or $100,000 if you think about not having health insurance and having, a huge unexpected medical bill. Next slide. So the marketplace offers a few different ways to help people pay for coverage. So the first one is called a premium tax credit, and it helps reduce the cost of your monthly premium. So depending on your age, household size, income, location, tobacco use, you're going to be seeing different prices. But the premium tax credits, they can be issued in advance or at tax time, and they just help you reduce the cost of your monthly coverage. So say I qualified for a $300 a month premium tax credit and my plan was $800 a month. I would be paying $500 because that $300 a month would be going towards the rest of that $800 premium. So folks can, like I said, can take it in advance to use to reduce the cost of their monthly premium, but they can also choose to claim it when they file their taxes and not use any of it to reduce the cost of monthly premiums. Most people choose to use it in advance because folks don't want to have to pay full price for plans. But there are some tax implications. If you end up making more money than you said you were going to on your application, you might have to pay a little bit of it back when you file your taxes. And it's based on your estimated income for the year. So if your income changes throughout the year, make sure that you update that so that they adjust the amount of tax credit that you're eligible for. And generally, people between 100% and 400% of the federal poverty level are eligible for premium tax credits. The American Rescue Plan did extend the upper income limit for some folks, but that's only temporary. Next slide. Another way that the marketplace helps people pay for their coverage is through cost sharing reductions. So they reduce deductibles, co-pays, co-insurance, and out-of-pocket limits. So they can make plans way more affordable than they would be without those cost-sharing reductions. But you've got to have an income between 100 and 250% of the federal poverty level in order to qualify for these cost-sharing reductions. And you have to purchase a silver plan on the marketplace. The marketplace has bronze, silver, and gold plans, and you can only use these cost-sharing reductions on a silver plan. Obviously, as your income goes up, the amount of help that you get goes down. Next slide. And we're on a recap. Kara, do you want to step in or?
Sure. Yeah, thanks for taking us through that, Donna. So to recap what we covered today, starting in April, North Carolina Medicaid will resume the recertification or renewal process to determine if people are still eligible for Medicaid. With that said, if you do have Medicaid currently, make sure that your contact information is up to date with your local county DSS office. And if you receive a recertification form from DSS in the mail, make sure to complete it and return it to DSS as soon as you can to hopefully prevent any gaps in your Medicaid coverage if you are still eligible going forward. And then last, it's important to know your options. So you have the right to appeal the decision. If you think that you should still receive Medicaid coverage, you can file an appeal of that decision. You can choose to reapply for Medicaid. You can also apply for insurance through the marketplace, like Donna explained. And importantly, free help is available, and it comes in several forms. So on this slide, we've listed several phone numbers and websites to keep in your bank of resources. So the North Carolina Navigator, as Donna said, you can access services like making an appointment with them online at ncnavigator.net, or you can call 855-733-3711. Another resource is to contact the North Carolina Medicaid Ombudsman. You can contact them by phone at 877-201-3750 or visit their website, ncmedicaidombudsman.org. And just a note that the ombudsman can help answer questions about Medicaid. Sometimes they can help try to resolve issues or help point you to answers to questions you might have. And then another important thing that they can do is make legal referrals for some Medicaid cases. And then finally, I have the contact information for Legal Aid of North Carolina. We have two helplines. The main line is 866-219-5262. And we also have a line, the senior legal helpline for anyone 60 and older. And that's 877-579-7562. So with that, if anyone has any questions, you can put them into the Q&A section if you're watching on Zoom, or in the chat section on Facebook Live. And we're happy to address any kind of general questions you might have. Just to repeat, please don't put any personal or confidential information because this is a publicly viewable video. Okay, and Sarah, just to double check, you are monitoring the Facebook chat. Are there any questions on that side?
There are no questions.
Okay. We'll give it one more minute in case anyone is trying to type anything in. Thank you for attending this clinic. And I hope that the information shared and the resources here are helpful to you. in the coming months.
Okay, since there aren't any questions, I just wanted to thank the presenters so much. Thank you, Kara. Thank you, Donna. This was wonderful. And I hope everyone has a nice afternoon.
Thanks, Sarah. Thank you, Donna.
My pleasure.